Hi guys, welcome back to my channel. My name is Monique Macrin and this is my COVID story. So first and foremost, I'm very grateful to be alive today. I know people have died. People died when I was still in hospital and people are still dying today. So I am very grateful for my life, and let me tell you, I've never gotten such a slap of reality like I did. And if you're watching this video, you only have today. So live your life to the fullest. Love like you'll never love again. If you want to hate, well, I don't think there's a point for hating, but whatever you're feeling, feel it to the maximum. Whatever you want to do, just do it. Tomorrow is not a guarantee. Because let me tell you, I came from walking myself to the cashiers to me being carried to the emergency department in a matter of minutes. And that's how I know that life is so short and no one is given like cues. No one there's mostly no premonition like something is going to happen to you. So I feel like for me, I now know how short life can be, and I know the value of life. Well, I still knew the value of life, but this was a unique and different experience for me. So now let me stop talking, but just know that I'm so grateful to be alive today, and I thank everyone who stood by me, those who visited me at the hospital, those who called me, those who visited my daughter back at home. Gosh, I needed that, and thank you so much. And lastly, life is for the living, so live it when you have it, because you just never know. So in this video, I'm going to be discussing about how I came to know that I have COVID, my symptoms, the cost of treatment, and the side effects. Stay tuned. Wait, this is the first day in 8 days that I'm in my living room, and it's the first day that I combed my hair. So and it feels so good. It feels so good because today is also my day 10 after my supposed infection, and that means I'm no longer infectious, but I still feel the symptoms. So I'm still wearing my mask, yeah, and everyone in the house is still wearing the mask. So I think my symptoms started like a week before the day I actually felt very sick, because I remember there was a time I was saying I feel like I'm drunk, but I know I'm not drunk because I haven't taken any alcohol recently. But I was kind of still feeling drunk. But at that point, I never read anything into it. Then on this particular Sunday, we come from visiting my dad. Then I get into the house and my head feels like I have 10 kgs of stone inside and on top of it. And I remember telling my family, I can't cook. I need to sleep because I am not feeling too well. Then I sleep. The following morning, I wake up, I get to work. I'm working, but I'm still feeling very lethargy. But still, I'm not reading anything into it. And then at some point, I tell myself, then let me get inside the gym and work out kidogo so that I can have my energies back again. I go to the gym and I just can't move my legs. Okay, I really worked out and I actually posted it on Instagram, but I was so breathless. And at this point, I still don't think I have COVID. Then I come back to the house at night and I'm not able to sleep. I keep turning and tossing. And I remember asking Harvey, oh my God, like I'm growing old. And he was like, why? And I'm telling him, I can't find a good position to sleep in. I can't sleep. This means I'm aging. You know, when you have a few years to get to 30, you already start to feel old. Well, so I wasn't able to sleep at night. And the following morning, I tried to wake up. I can't move my hands, vizuri. I can't move my legs. And I remember telling him, hey, I'm not feeling so well. Please hold me. Then he hugs me for some time and it's not getting any better. So I'm like, hey, this thing, I need to go to work and get a sick off. And we agree, so I take a shower. And I remember the previous night, I had made a meal that I love, but I didn't enjoy it because I was feeling like everything is bitter. But I suffer from acidity. So I was like, oh, okay, I think my acidity is back and up. Then, so back to this morning. And I know I seem tired and sickly, and that's because I haven't been sleeping. And I'll talk about that. So if I feel and sound tired-ish, please understand. I get ready, and I couldn't feel the smell of my perfume that particular day. So I used another stronger perfume that I don't use. And at that point, I'm still not thinking about COVID. I try to take my breakfast, but it doesn't taste well, so I leave it and go to the hospital. So at the hospital, I have this patient that I had booked an appointment with at 8 a.m. So I tell myself, let me see this patient first, then go get myself checked. But I couldn't. I tried to take their blood pressure and I just couldn't hold the machine nicely. My hand was shaking. So I was like, oh wow, this it seems like it's something serious. So I tell my colleague, please help me as I go and get myself checked. So I go, I remember going to the consultation room that was near to where I was, and it was empty, and I told the person I found there, I'm not feeling like I'm strong enough to go to the cashiers. Please recommend a test for me as I find someone who can come and sort the billing for me. Then they tell me, go have they gave me 2 tests to go and do. So I go to the labs, and then the people at the lab tell me, hi Monique, everyone who has walked in looking like you and able to tell us what you're feeling. I tell them I can't breathe with my nose, and then they're like, okay, don't continue, you need a COVID test. And I'm like, no, I don't have COVID, why should I be testing? And then they insist, and I tell them, no, if I have COVID, if you think I have COVID, then fine, I will go home and take the vitamins, you just do this test that I was told. Then they insist that no, have a COVID test done. Then I remember even the physician who had seen me at the consultation room, they had recommended for a COVID test. So I go, that's the swab that for the nasal test usually gets in up to this point. Mine refused at this point because my nose was that blocked. And she told me, Kai, my dear, you have COVID. And I was like, I don't have COVID. So after 2 to 3 minutes, my results are back, and yes, I have COVID. So the test for COVID is like 3,500 or 4,500. So yeah, I get my test, and I remember I cried, and she was asking, why are you crying? It's just COVID. And I said, I know, but I can't stop crying. And in my head I'm thinking, I visited my in-laws like a week before then. I visited my dad inside the car. We were all my siblings together. I hugged my hubby in the morning, my child. And then in the morning we were talking about the Delta variant and how it's killing people really fast within 24 hours. And this colleague was talking about how he has lost 2 neighbors in one night. And I'm thinking, am I going to be next? Will I stop breathing? Now, how does this progress? So will this headache continue? It was just too much. So I called 2 people. I called this one doctor and tell them, the test is positive. And then he's like, positive for what? I'm like, COVID. And then he told me, I don't even remember what he told me. I was just acting out of impulse. I was just calling whom I think I should call. And then I called my hubby. I know I called my hubby second because honestly, I was feeling he might not have the right answer for me compared to the first person that I called. So I tell him, my test is like this and I've been told blah, blah, blah. And he tells me, okay, continue. I will come. Then I'm like, okay, fine. So I tell myself, let me go back to the cashier first. So I take myself to the cashier with my 2 feet. But once I get there, I start feeling all kind of funny things. I'm shaking. It's like sweat is just dripping off me. My weight is too much for my legs to handle, and I'm feeling very drunk. I feel like I'm in a merry-go-round. Yes, I'm standing, but my body is moving like this. The headache is too much, and I feel like something is applying pressure on my head, and my head is almost bursting. So at that point, I'm at the cashier, and I'm trying to tell them to register me, but all of a sudden my eyes turn bluish whitish and I can't see, so I start crying. And the next thing I know, I'm in the emergency department and they're putting some IV on me, and I'm like, okay, that was really fast. That really happened fast. So I was really scared. I was like, if that happened in a matter of minutes, what's going to happen to me the next hour? You get? So COVID is a funny disease. The fear eats you up as much as the symptoms does. So after a few, I am well. So I go back and they tell me you need to be admitted. So at this point, my symptoms were a very severe headache. In addition to the headache being very severe, I was also feeling like pressure was being pumped into my head, into my neck, and everything felt like it was going to burst. It was just a matter of minutes and I was just going to burst open. I was feeling like I was drunk. Like even when you're sleeping, you feel like you are in a merry-go-round, and it's a very bad feeling and it can't stop. Then my knees were weak, my hands were weak, and I was feeling chills. I didn't have a temperature, but I was feeling very, very cold, and that was super funny. So before admission, I have to go back to the cashier because NHIF, by the way, I hate how the government is handling COVID. You know, I really hate it because NHIF has introduced this thing where you have to use your fingerprint. You know, and as much as I have another insurance cover, you all know that NHIF is a must. So it's the NHIF that is supposed to cater for your bed costs. So as much as I'm feeling this week, I have to go and have my fingerprint taken for NHIF. And I think that is very unnecessary. Okay, I'm not going to get into that topic because I don't know why they decided that. But for me, sick people don't have to go through that. So anyway, the NHF bit was, for me, I didn't like it. So I go back to, I am taken to the wards and then I sleep. By this time, the pain medication has already stopped working and the headache came back. So I requested for another painkiller, and then they told me, gosh, we gave you a strong painkiller, we at least have to wait for 6 hours. And I'm like, I can't wait for 6 hours. I need the meds now or I'm going to die. So I insisted. They added the fluids, they added the paracetamol. And then at that point, it just goes. The thing with this headache, you are on painkillers most of the time. So once the painkillers are in, the headache goes down with like a scale of 3. Once the pain meds are done, the headache is back. That was my life for those 2 days. And then I remember at one point, there's one nurse who told me, Kai, you know, try to take a lot of water because paracetamol is not very good for the liver. And I know that. So I think at that point, I'm like, what am I going to do? I need these pain meds, but too much of it also is going to destroy my liver. And I'm thinking, so for me to survive, that means I'm going to risk liver failure. And that was too much for me, by the way. So it came to a point where I was lying that my headache is gone so that I don't have to be on more paracetamol. But anyway, so at this point, I want to say that COVID is a very lonely disease because everyone who is seeing you has to be protected. There's restricted on the number of visitors, but close family can still visit you as long as they're wearing their protective gear. And I want to encourage, if you have someone who has COVID, please try to visit them at the hospital because the ward is isolated. So you're not supposed to be walking around freely like other patients. So you're inside your hospital. Like I was in this room alone for those days, not seeing people, but I'm so grateful for those people who risked their lives and came to visit me. Because, you know, as long as they're wearing their mask and you're not staying close to each other, you're in your bed, there's a safe distance, then everyone sanitizes, no touching anything at the room. You should be safe because anytime that someone came to visit me in my room, I cherished that moment because in the next room, there was a man who was in so much pain and that man was groaning and crying for like almost, since I was admitted, he was always crying and I could hear saying, oh my God. And I would cry with him and pray for him. And it was such a bad moment because you're surrounded with sick people and you yourself, you're sick. At some point, you would feel a sensation in your chest and you'd be like, oh, wow. So is that a clot now? Okay, so am I going to am I going to not be able to breathe now? Like, what is happening? And so anytime someone visited, I felt a relief because I was able to talk to someone and get outside of what I was feeling. Yeah, so anyone who made an effort to visit me, thank you so much. I really appreciate. So there's that bit of you being isolated, and alienated from the rest of the world, and even when people came to visit you, they can't get close to you. No one can hug you, they can't touch you apart from the nurses when they are giving you their medicine. And let me tell you, another thing that made me feel low was when the nurse would give me the medicine na kijiko hivi. At some point I refused, and I told them no, I need to give myself, because it just made me feel like I was not okay. So yeah, so that's the point with being admitted. It's a lonely disease, and if you know someone who has COVID, try to be there for them. And now let's talk about the stigma. I remember there was this house help that I had gotten on that Sunday, and when hubby told my daughter that I have COVID, and then he told the house help, Monique has COVID, so let's try to put our masks on for everyone. The nanny decided to leave. Immediately, he told hubby, actually, my mom has told me she needs me. And then she packs and leaves. So I'm in the hospital, and then I'm thinking, oh wow. So now the nanny has left. It's just my hubby and my child. He needs to work. My child needs more attention. Who is going to? So at this point, I also want to appreciate my hubby, because he was doing everything at the house. He was doing everything, taking care of my child, then coming to visit me and bring me fruits. And you know, when a disease strikes in the family, you bond differently. You bond differently with your partner, and you appreciate them differently. And then that stigma also extends to your friends, because there are those friends who feels like, you know, they can't visit your family back at home because they might get the disease. They can't visit you at the hospital, and in your head, you know, if it were not COVID, they would have visited you, they would have visited your family. So I feel like COVID is also being treated with a lot of stigma. So at this point, we have already pulled my child from the school, because I was like, I'm not sure if she's infected, and if she's infected, I don't want her taking it to the children, and then the children taking it to their parents. But I also remember when I called the teacher and told, during the very first day, I called the teacher and told her that I have COVID, and I think my child definitely might have been exposed. I need for her to come back home and protect the others. So hubby tells me that when she went to take my child, the teacher didn't even get close to them. You know, like she left Megan at some point. I was like, oh, okay. And I was like, the stigma is a little bit unnecessary, because we all know, as you wear your mask, yes, but I feel like, I don't know how I can put it, but I felt the stigma. But at the same time, there are people who came through for me, and I'm eternally indebted. And the nurses, oh my god, you do such amazing, people underrate nurses, but hospitals cannot run without nurses. Patients cannot be taken care of without nurses. Nurses are priceless in any hospital, and so are the doctors. But the nurses, anyway, let's move forward. So let's talk about the cost of treatment. COVID is a very expensive disease. I didn't need oxygen. I was not put on oxygen therapy, but my cost for those days, I was there for 5 days, 4 nights, and my cost was quite on the high side. I didn't expect that, because I mean, then I'm asking myself, what about those people who are on oxygen? You get, how much money do they spend? And imagine, NHF is not covering for bed. And bed is not for those days, bed is quite expensive. I mean, and this is not a disease that you had planned for. Imagine you telling yourself that I'm paying NHIF, I have an insurance cover, so in case of any medical emergency, I'm sorted. Only for you to be admitted and being told, since it's COVID, NHIF is not going to cover for your cost. I mean, that is hilarious. So apparently, they're not covering for patients who are admitted in private hospitals. They're only covering for patients who are admitted in public hospitals. But let me tell you something. I'm in that industry, and I tell you for sure, even a lot Kina KU hospitals, they won't take you when you have COVID. They are overwhelmed. The beds are full. So if the beds are full and you don't have the capacity to actually take better care of these patients in public hospitals, why are you denying? Why can't you pay for the bed cost for those in private hospitals? At the end of the day, these people contribute. They contribute. They make their NHIF contribution, and it's not cheap either way. So I was. How do I put? I was disgusted the moment I was told that NHIF was not going to cover for my bed cost. I was like, why? I pay my taxes. I contribute for the NHIF. It doesn't make sense, by the way. So COVID is an expensive disease. At the moment, a lot of hospitals are full, because I remember 2 days ago, 2 cousins of my neighbor were COVID positive, and one of them was not able to breathe properly. So we called several hospitals, like they couldn't get admission. One hospital that is taking COVID patient is Bellevue in South B, and the admission cost is like 100K. That is one hospital that, you know, if you have like a critically sick patient, you won't lack a bed, but then you have to have your 100K admission fee. So it's an expensive disease. And now that we are there, let me talk about the side effect that has still continued to be with me. Up to today, as long as I'm lying down, I'm okay, kind of, but I occasionally feel feelings in my chest. There are sensations in my chest that I'm feeling. I'm getting tired really quick. But the moment, okay, so as long as I'm lying down, I'm relatively okay. But the moment I get up, I feel like I'm going to drop down the next minute, because that drunkenness feeling is still coming back. I can't do a lot of things. Maybe even when if I'm walking to the toilet and back to my bed, I feel like I'm more tired in my chest than I usually am. My sense of taste, I never really lost it, but everything is tasting bitter and metallic, and I still have that up to today. My breathing is also not, I can't smell still as well. The headache is still there. So 1 minute I'm in pain, the next I'm not. But one thing that has been constant is I have a very foggy mind and a very heavy head. Yes. And insomnia. Since I don't remember when, I can't sleep. I can't fall asleep. So I have to induce this. I have to use medication to fall asleep. I can't sleep, and it's very tiring. And I hope that this is not how. I hope that this is something that is going to end, but I just can't fall asleep, and I don't know why. And then also there's that fear, especially when those chest sensations start. You ask yourself, so what is next? Because, you know, I know people, anyway, I don't want to be negative, so let me not get into that, but it's also a disease that leaves you with a lot of anxiety. You become very anxious. So now probably asking yourself, okay, could you have done anything different? If now the fact that you have had COVID, do you think you could have done anything differently? No. I still could have traveled. I hadn't seen my in-laws since last year November. I hadn't visited my dad since last year November. It's almost the end of the year, so I feel I tried as much as possible to stay away from them because I was protecting them from COVID. But honestly, this disease is out there. You never know when you're going to get it. Even them, they could get it from anywhere. So I don't think I could have done anything differently. So yeah, I don't feel guilty of anything. I think even after this, I will still try and have some fun in my life. I will reduce visiting, but if once in a while I feel like I will go to a hotel, I still will. I mean, you could just die of a road accident out here. And this COVID is here to stay. So as long as you're putting on your mask, you're washing your hands, then by all means, continue living your life. But of course, if it's a place that is crowded, I'm not going to go to a crowded place. I'm not going to be in public without a mask, but I'm going to continue living my life because I know life is short. And I might not die of COVID, I might die of another cause. So I might as well create memories when I'm still alive because COVID is here to stay. And you don't know where you're going to get it. So a challenge that I found I experienced being admitted at the hospital was physical activity. So the nurses will continue telling you, you are at the risk of getting a thrombosis. That is a blood clot. You are at a risk of getting a clot once you have COVID. And clots will kill you, definitely. So they keep telling you, you need to get up and walk. But the moment you try to walk, hey, it's so hard. So when I was in the hospital bed, I tried to do a little bit of exercises that I could, and I'm going to have that video on Friday, so that if you are admitted and there is basically no space for you to walk, those are activities that you can do in your bed space. And also those are the activities I have been doing in my isolation room, because I have been isolated in my house since I was discharged. And yeah, physical activity is going to be very important for you. You don't feel like doing it because you are tired and you don't have the energy, but if you don't do it, yeah, you're going to get blood clots. So check out for my video. If you have any question, please ask. That's about it. Is there something I haven't discussed? So I talked about my symptoms. I talked about the side effects. So currently on my medication, when I was there, I was on IV fluids for the better part of the days, pain medications, and then I was being given antibiotics. And I remember this antibiotic, every moment ikiingia kwa mwili, I used to vomit. Every minute it gets okay, but it was injectable, so I don't think the vomiting was affecting with the meds. So I was on antibiotics that was being given via drip. I was on painkillers via drip. I was also on orals. I was on vitamins. I was on vitamin C and zinc. I was on anti-thrombosis medication and anti-anxiety medication. Because yes, the reason I was put on anti-anxiety, antidepressants was because on day 1 and day 2, I started developing confusion. I could forget. Like, I remember like they could give me medication like right now, and then after 2 minutes I'm telling them, you haven't given me the medication. So I think I was also being confused. I could tell you this now and forget the next minute. So they had to put me on antidepressants. So, and I understand that symptom is not unique to me. A lot of people are getting confusion. I wasn't remembering days of the week, time of the nini. So I was on anti-thrombosis. I was also on, those dawas are called blood thinners. Yeah, I was on blood thinners, those antidepressants. I was on vitamins. I was on cough syrup. And now those drip IV fluid, IV meds. I think I've given you almost all the information that I felt I needed to share. But bottom line, it's a very funny disease. Very funny disease. Even right now, it's my day 10. 1 minute I'm okay. The next minute I have a headache. And the next minute I feel like I'm drunk. Yeah. Oh, and let me tell you something. For 3 days, I couldn't breathe with my nose. I was breathing like this, because my nose was totally blocked kabisa. I couldn't use my nose. Yeah, so I really appreciate the role of a nose. I can breathe like this. It's still stuffy, but I can breathe with my nose. So yeah, there's also a lot of things to be grateful for. So yeah, it was a bad experience, but also an experience that made me experience life a little bit differently and appreciate people and things and moments. So yeah, I think I'm going to stop this video here. Please watch it. You can share. And yeah, wait for the video that I will share on how I was able to get some physical activity in my hospital bed, because you need to exercise so that you don't get the blood clots, and also so that you don't lose muscle, because it happens when you sleep for too long. You're definitely going to lose muscle. So until next time.